Hello everyone, I am Dr. Jenith, working as Assistant Professor in Department of Community Medicine, PSG Institute of Medical Science and Research. I am very glad I am meeting you through this video. I am going to cover the topic on communicable disease. I will be briefing about what a communicable disease is, the pathogens and how it is being transmitted. Next, I will be talking about how to prevent the communicable disease, and finally I will be talking about certain personal hygienic measures. So let's start. First, what is a communicable disease? A communicable disease is a disease which is transmitted from an infected person or an infected animal to a susceptible host, that is a healthy person. It is in the sense catching up of a disease. A person acquires the disease in the community, he rapidly transmits the disease to the other people so that the whole community is being infected. Right. This communicable disease is caused by microorganisms, which are also known as germs or pathogens. The four major microorganisms which are causing the diseases are bacteria, virus, fungal and protozoal infections. Right. So I will give you an example for each of the organisms causing the disease. One is bacterial disease, example is typhoid, cholera and tuberculosis. For a viral, it is chickenpox, rabies, and the recent current pandemic COVID-19 is also transmitted by virus. The third is a protozoal infection, which is example is malaria and amoebiasis. The final one is a fungal infection which is caused by ringworm or candidial diseases. So, how the disease is transmitted from an infected person to a susceptible person? It is either by means of a direct transmission or by means of indirect transmission. Direct transmission occurs by handshaking, hugging, kissing or by means of sexual contacts. The organism is transmitted from an infected person to the susceptible host. Whereas the other modes of transmission comes under the indirect transmission. It can be a airborne disease. Next is through water, known as waterborne disease, and it can be transmitted to vector, which is known as vector-borne diseases. And it can be even transmitted by few arthropods, which are known as arthropod-borne diseases. Right. So I am going to deal you with in depth about one of the most common mode of communicable disease is the fecal-oral route of transmission. Here in the diagram we can see from the fecus the pathogens is being transmitted to a susceptible host either by fingers, flies, fomites or by fluids, and the next medium can be either a food or directly this can be transmitted to the host. Fingers we very well know, right? Through the fingers, through the feces, self-infection can also occur to the same person. Next is flies. For example, housefly sitting on a feces and through his legs, it can transport the microorganism to the food. Fomites. What do you mean by fomite? These are inanimate objects. Examples, a table or a chair, they can contain an organism. When you touch it, you can acquire the microorganisms in your fingers. And finally, fluids. Fluids means water. The diseases can be transmitted through water also. These organisms either directly can be transmitted to a susceptible host or they can be transmitted through an intermediate part which is known as a food. From the food, it can be transmitted to a susceptible host. Right. Moving on to the next concept which is known as epidemiological triad. What does epidemiology means? Epi is among, demos means population and logi means study. This is a study among the population. It has been inferred that for a disease to occur, there are three major factors which plays a crucial role in acquiring the disease. Those are known as agent factors, host factors and environmental factors, which I will be enlightening you one by one. What is the agent? Agent is the microorganism which is causing the disease. Depending upon the pathogenicity or the virulence. In other words, we can say the violence of the pathogen. For example, malaria, there are 4 different species, out of which 2 species are more violent, which can cause us a life-threatening condition, whereas the other 2 organisms are lesser forms which causes a milder disease. Next, moving on to the agent factors. Agent factors can be age, gender or the genetic factors. For example, an elderly person, the immunity power of the person will be very less. So, there is more chance of acquiring the disease. And the final factor is the environmental factors. Everything and anything which is comes outside the person is known as a environment. It can be a soil, it can be a water, it can be fluids, anything else. This, for example, we know the fact that dengue is transmitted by, it is by the artificial collection of water. If you have many containers where there are artificial collection of water, then it becomes a breeding site for the mosquitoes, and through these mosquitoes the person who are residing nearby can get the disease. So, having introduced the facts on the pathogens, next what are the modes of transmission, we will move on to our next objective, which is how we are going to prevent the communicable disease. It is basically by breaking the chain. We know the fact epidemiological triad and the mode of transmission. The epidemiological triad is agent factors, host factors and environmental factors. Either we have to attack at the agent level, host level, environmental level, or finally at the mode of transmission level. How we are going to do it? With regard to the agent is the pathogen. The pathogen can be destroyed. How we can destroy it? For example, in the current pandemic, we are using sanitation method. What is sanitation? We are using a sanitizer where the pathogens can be killed. So, we are destroying at the initial stage. Next is how to protect the host. This can be done by vaccination. So, we are having 7 vaccine preventable diseases. Proper vaccination can prevent the transmission of the disease. Next is we can boost the immunity of a host. How the immunity of a person can be boosted? By proper nutrition and proper physical activity so that he becomes fit. And the third is the environmental factors, which is also known as the reservoirs. As I already mentioned, the environmental factors for dengue is artificial collection of containers having water. So, these containers, when we remove, the breeding site for the mosquitoes can be removed. Thereby, we prevent the environmental factors in transmitting the disease. And final mode is the mode of transmission so that the susceptible host can be infected. For example, if it is a respiratory infection, wearing a mask can protect a person from acquiring the disease. When the disease is waterborne or foodborne, using clean and safe water or using hand hygiene or food hygiene measures, the transmission through the water and food can be prevented at the susceptible host level. This is how we are going to attack the microorganism at the different levels so that the susceptible host can be protected from the communicable diseases. The final word about prevention is on the sanitation barrier. I already explained you about the fecal-oral route of transmission of the disease. From the fecus, the microorganism can be transmitted to fluids, fingers, flies as well as the fields. How we are going to segregate the fecus in transmitting through these intermediate agents is by segregation of the fecus, where the introduction of sanitary latrine came into play. Previous years, when there was a practice of open air defecation, there were more communicable diseases. After the introduction of sanitary latrine, usage of restroom facilities, we have completely cut off the fecus transmitting the microorganisms through the fecus through the other agents. This is known as the primary barrier, sanitation barrier. The next method is the secondary barrier. How come secondary barriers plays a crucial role in protecting the host? For example, water. Water is transmitting the microbes. How come we can prevent the water transmitting the disease? Is by boiling it. It is known as rolling boil, filtering it, and proper storage can prevent it. Next is fingers. the transmission through the fingers can be prevented by proper hand washing technique. Third is prevention of flies. How come flies can be prevented? By using pesticides, the flies can be destroyed. Final is, how come the fields is that nothing but the soil. Soil transmitted infection can be prevented by, for example, the soils, the vegetables and fruits which are grown in that soil can be contaminated. So the fruits and vegetables has to be properly washed so that the disease transmission can be prevented. And finally, the food has to be safely prepared and it has to be cooked properly and it has to be properly stored so that it does not become a growing medium for the microorganism. So these are the 5 F's which is mainly concentrated in preventing the fecal-oral route of transmission. I repeat the 5 F's. One is fluid, next is finger, third is flies, fourth is field, that is the soil, and finally the food. Right. Having said this, I will move on to my third objective of, I will brush you about the personal hygienic measures. First, as soon as we get up, we have to take bath, right? Taking bath, how frequently taking a head bath is advisable is at least twice a week the head bath has to be taken in order to protect ourselves from lice and dandruffs. Next is brushing the teeth. We already know the fact that the teeth has to be brushed twice, but evidence shows that most of us feel lazy, so we don't brush during the night time, which has led to dental decay as well as caries, which is more prevalent in the community. So we have to remove our laziness, and brushing our teeth at least twice is recommended. Next, how to brush the teeth? The front tooth has to be brushed in the movement of upward and downward direction, and the side tooth has to be brushed in a rotatory movement. The frequent doubt is what toothpaste and what toothbrush has to be used. The toothpaste recommended is fluoride containing one is a better one. And with regard to the toothbrush, apart from trade names, the toothbrush are soft, medium and hard. Depending upon the texture and the bristle strength, it is soft, hard, or it can be a medium. The preferred one is a medium one. When to change the toothbrush? The purpose of brushing the teeth is to remove the microorganism which is present in between the clefts. So once the bristles bends, the purpose of brushing does not solve. So once the tip of the bristles bends, then we have to change our toothbrush. Next, cough etiquette. Frequently we can get a common cold. So as a result of getting a common cold, what we do? We cough or sneeze. So whenever we get a common cold, the practice of using a handkerchief or a tissue paper when we cough or sneeze is a must. Otherwise we can use a mask so that we prevent the transmission from us to others. And one of the bad practice what we do is, whenever we feel like coughing, what we do is we cough into our palms. So what will happen? Our hands will get infected and this can transmit the disease. So whenever we cough, we have to use the elbow, right, in such a way so that we don't acquire the disease. Next, with regard to the hand hygiene, we know that each and every part what we are using is contaminated. For example, the toys what we are using, the sports item what we are using, as well as the electronic goods like laptops, mobile phones, all are being contaminated by microorganisms. When examined under the microscope, there are numerous pathogens which can cause a multiple number of diseases. Especially the restrooms will be flooded with these microorganisms. So what we do? We have the practice of washing our hands. But literature has shown that even after washing, there are certain parts which are not touched while washing, especially the tips of the fingers and the thumbs are not being washed properly. So the transmission chance due to non-washing the hands is more, right? So what can be done? The World Health Organization has demonstrated 6 steps for hand washing. I know the fact that though you already know about this, I will just demonstrate so that we can recollect the 6 steps of hand washing. The first step is the palm has to be placed on the other hand palm, right? This is the first step. Next is the palm has to be placed on the back of the hand. This is the second step, right? The third step is in the interdigits. We have to interlace the fingers so that the interdigits are cleaned properly. The fourth is back of the fingers. Fifth is we are going to clean the thumb by means of a rotatory movement over the thumb. And the final step is the tip of the fingers, right? The care should be taken in cleaning both the hands, right? By practicing these 6 steps, we are completely eliminating the microorganisms which are present in our hands. So, by practicing these 6 hand washing steps, we can eliminate the pathogens which is present in our hands or fingers, and thereby the disease transmission through our hands can be prevented. Next is trimming the nails. Most of us have the habit of chewing or biting the nail. As a result of which, this place is the most favorite place for germs as well as dirt to lodge. Because this is a huge space between the nail and the nail bed, the dirt accumulates where the microorganisms can be present. So during eating accidentally, what will happen is this dirt or the microorganism can be introduced into our gastrointestinal tract, as a result of which a person can get diarrhea or fever can occur. So what has to be done? The nails have to be trimmed every week. With regard to the nail cutter, usage of a curved blade is better. Don't ever use a shaving blade which can harm yourself. Before concluding, one of the important steps is whenever you walk out of your home, please use either a chappal or a shoe. This is because we think my legs are good, there is no cracks, no trauma. Then what will happen? It is because there is an organism which is a hookworm infection. Even through an intact skin, it can creep through the intact skin, through the legs, and it can suck off all the blood, leading to a blood loss, right? So whenever you go out of your home, have the habit of wearing shoes or chappals. And finally, to conclude, after acquiring the disease and then taking treatment, it is better to have the practice of prevention is better than cure, so that you will be able to safeguard yourself as well as your family members. I conclude by saying that in the current pandemic, please ensure that we are using the SMS technique. What is this SMS technique? One is using soap for frequently washing your hands. Next is wearing mask whenever we move out of your home, and third S stands for social distancing. So maintain social distance whenever you move out, wear a mask, as well as have the habit of washing hands with soap and water frequently when and where required. Thank you.